President Biden announced yesterday that his administration will soon hit its goal of administering 200 million COVID vaccine doses to Americans in his first 100 days in office. But the milestone does come amid reports of a recent 11% decrease in the number of shots given over the past week. Joining us now to discuss the country's vaccination efforts is Dr. Cioe-Peña, emergency room physician and director of global health at Northwell Health. Good to see you, doctor. Thanks for joining us.
Morning.
Describe how significant this milestone of administering 200 million shots for the president. I mean, it's a tremendous goal. Originally, if you recall, after the inauguration, President Biden said that he hoped to administer 100 million shots by his first 100 days in office. Now we're at 200 million. So talk about that milestone, but also, are you concerned about the declining vaccination rates?
Thank you for having me. Yeah, so this is a great milestone. You know, this is kind of what we expected to happen at this stage, is that as the vaccine production scaled up, as states received supply more steadily and were able to kind of more directly plan for large-scale vaccination campaigns, we expected the rate to accelerate. So we're right on target, and that's great. Now what we're seeing is the people that have been very, very eager, that will go to great lengths to get the vaccination, have mostly been vaccinated. And now we're dealing with a second group of people who probably are still in favor of vaccination, but haven't been kind of checking the websites compulsively. You know, will get it when they next have a healthcare appointment. And those are the people we have to do active outreach to make sure that we get them vaccinated as soon as possible. I think that we are definitely in that second stage, though, where we're now dealing with people that aren't opposed to it, but aren't as eager to get it.
And maybe this is connected because we're also learning that a large number of counties around the nation are reportedly declining vaccine shipments after months of many states requesting, more, give us more. What do you make of this? How do we reach those who may be concerned about getting the vaccine?
So I think, we need to have conversations with people. I think that part of even people that are vaccine hesitant, we're all preparing to have, these difficult conversations, to go over the data, to go over the results, to go over what the trials were, to explain the risks and benefits. And I think most reasonable people are going to make a decision to get the shot after that. These mass vaccination sites are really, marketing to people that have already had that kind of discussion in their mind. So one of the things I would encourage people that are on the fence about is call your doctor, call your healthcare professional, have a conversation about it, and if you decide to get it, make an appointment and go. That really is the next step, is that we need to talk to the people that are, that we don't want to just go into a drive-through vaccine center, but want to have a conversation with their healthcare professional, and we need to be doing some active outreach to make sure that that happens.
Doctor, the CDC has found no obvious safety signals among pregnant women who got an mRNA COVID shot. That includes the Moderna and the Pfizer vaccines. The study does say more comprehensive research is needed. What is your advice to women who are pregnant, and have similar studies been done with Johnson & Johnson?
Yeah, so I think that one of the things we need to understand about pregnancy and the COVID vaccine is there is no evidence that supports any harm. I agree with the CDC that more research is needed. Pregnancy is a tough thing to study when you're doing a vaccine study. But we don't have even a theoretical way that this could harm a fetus or harm a pregnancy. What we do know is that COVID infection is very dangerous during pregnancy and needs to be taken very seriously. So when examining the risks and benefits, I agree that more study is needed, but we haven't been able to find any harm, and there is clear harm with getting COVID. In terms of Johnson & Johnson, the adenovirus vector is a little bit more well studied and well understood, and no other adenovirus vector vaccines have demonstrated any harm in pregnancy.
Sorry for cutting into you there. Scientists who helped develop the Pfizer vaccine says that a third booster shot will be necessary as immunity wanes. Moderna already announced that it plans to have booster shots available by the fall. The Biden administration said last week that it's preparing for the potential need to administer booster shots in the future. So, in your opinion, are we looking at something that, may be akin to the flu shot, where you kind of need to get a yearly shot to maintain your immunity?
I think that's the worst case scenario. I think we need to be very careful in parsing preparing to deliver a booster and the need for a booster. We have not been shown evidence to date that there is a need for a booster vaccine. So far, everybody that's been vaccinated, even in the earliest trials, still have immunity to COVID. So we are preparing for it. And we need to watch the data carefully to see when immunity wanes. But right now, there's no population study that shows a need for a booster. I think it's great that we're preparing to do it, though.
All right, Dr. Eric Cioe-Peña, thank you very much.
Thanks for having me.